Hi, I'm Lieu from the University of Colorado. I'm a GI medical oncologist. So what are the common or severe side effects that can be expected with treatment with bevacizumab and atezolizumab for hepatocellular carcinoma? So when you think about liver cancer, we call it also hepatocellular carcinoma. You'll also hear it called HCC because hepatocellular carcinoma is a lot to say. When you think about the therapy and even the sequencing of therapy for patients that have advanced hepatocellular carcinoma, this has changed in unbelievable ways over the last 3 to 4 years. When you think about the history of hepatocellular carcinoma, the first ever FDA approved agent was approved in 2008. And there's only just one drug. So from 2008 all the way to 2017, there is literally only one FDA approved therapy for advanced hepatocellular carcinoma. And that was a drug called sorafenib, which is an oral targeted pill. But since that time, there are actually now over 9 treatments or regimens that are available for use in patients with advanced hepatocellular carcinoma through different lines of therapy. So interestingly, when we think about treating metastatic cancer, we immediately think of chemotherapy. But for HCC, traditional systemic chemotherapy has never been shown to improve overall survival for our patients. So most of the research for liver cancer has really centered around this idea of using something besides chemotherapy. And the research has focused really on targeted therapies and immunotherapies. So one of the major breakthroughs in cancer medicine has been the development of targeted therapies, where drugs are used to target something on the cancer cell. And we can think about that as a type of smart bomb, where you're kind of trying to target the cancer cell directly. And this is compared to chemotherapy, which can be thought of dropping an unguided bomb, where you may or may not hit your target, but you certainly get a lot of collateral damage to other areas, which in our bodies, of course, would be our normal healthy tissues, which is what we don't want. The other major breakthrough that has made a ton of headlines over the last several years is the use of immunotherapy for patients with cancer. And these are drugs that try and get the human immune system to be able to recognize and fight the cancer for us. When you look at the combination of targeted therapy and immunotherapy, this is the combination that has been proven to be effective for patients with hepatocellular carcinoma. Atezolizumab, which is a big word, but the name of the drug, is an immunotherapy that tries to break a stop signal from the tumor to the body's T cells and that prevent the tumor from getting attacked. So this is called an immune checkpoint, and we call it an immune checkpoint because it is a way for the tumor to actually evade the immune system by telling the T cells to stop. Atezolizumab breaks the signal and hopefully turns that stop signal into a go signal where the T cell is actively targeting the cancer. Bevacizumab is a drug that targets tumor blood vessels. And so for a tumor to grow more than a centimeter, it has to grow its own blood supply, almost like a tree growing roots. And what bevacizumab tries to do is block that blood vessel growth, essentially a pruning of the roots of the tree. And hopefully, if the tree can't get its nutrients, then the tree begins to die. In 2020, there was a study called the IMbrave 150 study. And this attempted to investigate this combination of atezolizumab, that IV immunotherapy, and bevacizumab, that antibody drug that targets tumor blood vessel growth. And so they're trying to combine these 2 drugs and compare it to sorafenib, which is the standard of care targeted therapy pill at the time of the study. And these were in patients with previously untreated advanced or metastatic hepatocellular carcinoma. The result was an incredibly impressive improvement in progression-free survival and overall survival in the patients that were receiving the immunotherapy and the targeted therapy combination. This study not only told us a lot about how effective the combination of atezolizumab and bevacizumab was, but it also told us a lot about the side effect profile of what happens when you combine these drugs together. So within the study, and if somebody's taking atezolizumab and bevacizumab, what would we tell them? We would tell them that the more common side effects were high blood pressure, also known as hypertension, and fatigue, as well as having some protein in the urine, and we call this proteinuria. Other less common side effects were itching and diarrhea, and there were several patients that had some decreased appetite, rash, and some mild nausea. Overall, the side effects of the combination of atezolizumab and bevacizumab did appear fairly well tolerated. But in that study, we do want to say that about 15% of all the patients that were receiving that combination did discontinue at least one of the drugs, and 7% discontinued both drugs. But compared to the standard of care therapy, a drug, sorafenib, they actually did quality of life comparisons. And the quality of life was significantly improved in the patients receiving atezolizumab and bevacizumab. So even though there's a percentage of patients that may have some higher blood pressure, some fatigue, maybe even a little bit of nausea, these patients still had a much better quality of life compared to those patients receiving sorafenib, which is that targeted therapy pill. It's important to understand that all patients respond and react differently to these therapies, and close communication with your treating physician is critical to ensure that the side effects that you're experiencing are addressed promptly. And so this is a way that to ensure that you feel as good as possible. If there are adjustments that need to be made to medications, that can be adjusted appropriately. And as always, the more your treating team knows how you are feeling, the better they will be able to take care of you. So never hesitate to mention how you're feeling and what side effects are somewhat tolerable and what side effects really aren't, because this is how you're going to get great care for you and the treatment that you get for your cancer. Thank you.